Hello, everyone. I want to thank you all for joining us and welcome you to our webinar this afternoon on life in prison during a pandemic. I am Zain Beg with Islamic Council for Social Justice. For those of you that don't know, ICNA Council for Social Justice is a human rights organization that strives to facilitate Muslim involvement in the field of human struggle for the rights of the poor and oppressed in the United States of America. I am joined by many guests that will be introduced shortly by our moderator. Before we get into this very important topic, I want to talk about our project at ICNA CSJ, the Muslim Prisoner Support Project. The Muslim Prisoner Support Project's main objective is to support Muslim inmates in detention centers and correctional facilities by providing them with prayer services, Islamic education, equipment, supplies, and resources to ensure they are given their full rights and treated in a civil manner. As you can see, the link below on this live broadcast, you can donate to our project and any donation is acceptable. Therefore, we hope that this conversation will shed some light on those who are struggling inside the prisons, especially during a global pandemic. Now, I have the pleasure of introducing our moderator for this afternoon's dialogue, Johnny Perez. Mr. Perez is a renowned criminal justice reform leader who currently serves as the director of the United States Prisons Program for the National Religious Campaign Against Torture. He's a speaker and organizer that has been invited to provide major presentations on criminal justice reform at law schools, as well as high institutions nationwide at the state, national, and regional level. Mr. Perez has made multiple appearances on Now This, Capital Tonight, and the Sundance Film Festival. He continues to mentor formerly incarcerated students and provides them with guidance. Please welcome Johnny Perez.
Thank you. Thank you so much for having me, and thank you for creating space, on your platform to talk about this serious issue. As you mentioned, I work as director of U.S. prison programs for the National Religious Campaign Against Torture, and how I came into that work is actually through my direct experience, having served a number of years while incarcerated, including solitary confinement. Thinking about now in this moment around COVID-19 and how it impacts people on the inside, I'm really happy and honored to moderate this conversation. Just to talk about the flow a little bit, I'm going to frame the conversation for about 10 minutes and then introduce our guest speakers and then bring it back to close us out. So I'm going to go ahead and share my screen right now to start us right off. Right here. Perfect. So folks should be able to see the screen now. As I mentioned, my name is Johnny Perez, Director of U.S. Prison Programs for the National Religious Campaign Against Torture. And today we really want to have a discussion around the United States prison system and the United States criminal justice system and COVID-19, and basically have a call to action to all of you. The first thing that I guess we need to understand about incarceration settings is that they don't prioritize security or the health and well-being of people who are currently incarcerated. And this fact is actually augmented in times of societal crisis, right? We see that incarcerated people are not valued during these times, and also in a lot of different ways, they're not even seen as being worthy of being saved, but instead are in many ways exploited for the benefit of the greater good of society. During my incarceration, I spent 13 years in prison, and I can remember a number of times when I was really afraid. And one of those times that I was really afraid was actually during September 11th, 2001, during the September 11 atrocity, if you will. Right after September 11, we saw a number of things happen. Right, we saw an increase in incarceration. We saw an increase in racial profiling and bigotry, particularly regarding people from the Muslim community and faith. Right? We saw newly created governmental agencies, which would impact what we like to think as a new normal here in the United States. Right? We see that these different government organizations building up that end up facilitating the separation of families, specifically ICE. We think about ICE a lot now, and it actually came and rose after 9/11, after the disbandment of INS as we know it. We've seen some of the correctional responses at the time was to lock everyone inside of their cells and cut people off from the world. And I was incarcerated at that time. I remember, having increased fear of not knowing what was going on outside of the cell, not being given information, not being able to see my family, all while I was awaiting trial before I was even found guilty, which is the reality for many men, women, and children who are incarcerated in our nation's jails in this moment. We also saw this extreme isolation of people, where they saw no phone, no recreation, no visits, or even no court for months. The second time that I felt like that was actually during Hurricane Katrina in 2005. And for those of you who may remember, during Hurricane Katrina, specifically in the Louisiana area, we saw hundreds of incarcerated people who were left abandoned inside of their cells and left to die. At the time, there was no food, no water, access to medical care or mental health treatment. There's no family visits, mail, phone, etc. And more importantly, those same kind of responses that we saw then, we saw a little bit now we see it now during the COVID-19 pandemic. And to talk about that, actually, we invited on two guests who are going to really outline that, to answer some of the questions that are really important and pertinent in this time, right? What are the experiences of incarcerated women and girls in this moment? And I say women and girls specifically because when we talk about the criminal justice system, women and girls are often left out of the conversation. We assume that only men are impacted by it. Women and girls are impacted in a particular unique ways during incarceration. Right? What is the experience of incarcerated people during the month of Ramadan? As we start the month of Ramadan, folks who are incarcerated, are actually prevented in many ways from practicing their faith and religion behind those barbed wires. And we want to take a look at exactly what does that look like and what does that mean for folks, right? And then we also want to talk some solutions, right? Like what are the critical policy changes that need to happen in this moment? And of course, we always want to analyze what are the correctional responses to COVID-19, not only in my own home state of New York or where you're watching this live stream from, but also across the United States. So to help us get there, we have Naquasia Pollard, who is the founder and director of Legacy Incorporated, which provides residential spaces for young adults who have been impacted by the criminal justice system. I'm happy to announce that she's also an advisory council member at the National Religious Campaign Against Torture, where she helps transform our work and inform our work around solitary confinement and other conditions of confinement. She's also worked with the Probation and Parole Reform Project, and for the purposes of this conversation, she is uniquely positioned to share her expertise with us, having had her own direct experience with incarceration. And please, if you haven't already, please follow her on Twitter, and we'll share the Twitter handle again later. And then also, we're honored to be joined by Amy Fettig, who is currently working as the Deputy Director at the ACLU National Prison Project, and also directs the National Stop Solitary campaign. I'm a proud colleague of hers, also having to share space with her on as a steering committee member of the Unlock the Box campaign, where we right now really support 14 different state campaigns across the country, all seeking legislative change to end solitary. And please follow her on Twitter, and there is her Twitter handle. So I want to stop sharing my screen right now and patch them in. Here we go. Awesome. And I see folks coming in. There we go. So we can finally jumpstart this conversation in the question. I'm going to come right to you. I know I introduced you briefly, but you can share anything that you think is important that I left out to share. And then we want to get right into the question, and what I want to ask you is literally like, what are the experiences of incarcerated, people in this moment? Like, what are you hearing from folks inside? If you can paint a picture, and kind of bridge the gap between what's happening inside and out here for people who don't know anything about the issue.
Thank you, Johnny. Thank you for having me. Well, as far as I know, from me corresponding with the sisters that are currently incarcerated at Bedford Hills Correctional Facility, it's fear, and unknown. They fear the unknown because they're quarantined on their units and they're locked in. Their meals are provided to them through the mess hall on their unit. They're not allowed to congregate together like in the day room, in the yard, the gym. So basically, they're 24 hours locked down. They're not allowed to go out their cell. Just recently, yesterday, our friend Lulu, that we called her, she died yesterday from COVID-19.
Wow.
In Bedford Hills Correctional Facility.
And Bedford Hills is in New York. Is that correct?
Yes, yes. Bedford Hills is in Westchester County. It's the richest county in New York State. And they have Bedford Hills Correctional Facility is there, and so is Taconic Correctional Facility. And they're right directly across the street from each other. And in Taconic, it's also fair because they're locked down, and that's a minimum correctional facility. So, where there's usually a lot of movement, there's no movement. No, they have both correctional facilities in the whole New York State has suspended visitation. They're allowed to come out to call, but that's it. And they were granted one free call by the state,
Wow.
right, during this whole ordeal. So it's a bunch of feelings among especially in the Muslim community, because this is our holy month of Ramadan.
Yeah.
The sisters are not allowed to go make salat together. They're not allowed to read the juice, which is 1/3 of the Quran. Read every day. They're not allowed to do that either. So it's a bunch of fear and unknown. Like, I have a friend, she has life without the possibility of parole, and she has a respiratory compromised immune system, and she's scared because she said that if I get COVID-19, like, I would never be able to recover, like I would die in here. And currently she's fighting her case to give time back, but there's no guarantee. The only thing that they are allowing them to go to the law library, because that's their constitutional right as a person that's being held in a correctional facility. They can't be denied, especially if you have an active case. So it's a lot of, especially for the Muslim sisters, they're not allowed to practice their religion.
Yeah.
And that's unfortunate, and they don't know what to do. They are, making salat and they sell, but Ramadan is a time of togetherness, unity, sharing and learning and teaching. And that's not being done because of a pandemic. The officers, the ones that are bringing it in, the correctional facility, because the people that's being held in don't go out. So an officer was exposed to COVID-19 and brought it to the prison.
Wow.
And he tested positive. A couple of the correctional officers tested positive for COVID-19, and they were sent home. But by that time, it was basically a done deal. Every the women that are being held there were compromised, especially if they have, and it's a lot of sugar diabetes in of women, due to stress, hypertension, etc. And they're being compromised. There's a lot of women that's incarcerated that have cancer, and their cancer ends in remission. So it's just it's a lot of fear.
Quick question:
Anxiety.
one of the things I've heard from other states is that there's been advocates who have donated masks and other protective personal equipment, right? But I've heard reports that equipment hasn't been getting actually to the hands of the people that are incarcerated. I've even heard cases where correctional officers have kept some of those donations, specifically in New Jersey very recently. Like, what are you seeing there? Like, are one, what does, is there access to mask and equipment for the women that you're working with? Has there been donations made? Like, what's that whole entire scene look like as far as getting equipment to the people?
That scene is, they're not allowed to, because when you're incarcerated, you're not allowed to cover your face. So that means that they're not being provided the equipment that was donated to the prison. So that's why a lot of women, that's why they have a lot of cases in Bedford Hills Correctional Facility. I think it's like 15 cases that women are sick, and it's on different housing units. So, it's spread out, and, they're putting them in the RMU, the infirmary, which is the clinic, where they stay, and quarantining them, but not giving them and other women that's in general population the proper material to protect themselves, because they're saying that they're inmates and they're basically not entitled to that, and that the correctional officers feel that they have to be protected and they wear masks while during their work hours, which is unfortunate. Like they're human beings, and they're being neglected. And it's unfortunate that they have to experience this and don't know, like they don't have the proper health care. Anyone who has been incarcerated, and I did 15 years of incarceration, I was just lucky to be healthy. A lot of my friends and a lot of my peers are not as healthy as I was.
Hmm.
So their immune systems are being compromised and because they feel that the correctional system feels like they're less human. So why should they be provided these materials to protect themselves, to stop the spread?
Hmm.
And it's not happening. Mhm.
Interesting. And before I pass it over to Amy, like what is your, like what's your, you know, I don't know, within the last 2 months, doing the work that you're doing and going in there and engaging, these folks who are, who are like there and vulnerable, very simple. Like what's your biggest fear right now in this moment?
My biggest fear is that the state as a whole in New York State and throughout the, nationally and internationally, that, if you're incarcerated, you don't deserve the human right to be protected if you're not infected. That's a problem.
Hmm.
And I think as advocates that we need, and I'm a part of a task force through the Beyond Roses campaign, and it's a lot of women that have been directly impacted that form a task force to be able to help the women that are in Bedford Hills, Albion, Taconic, Bayview, and other facilities that, to get them protective gear, etc., and get them the hygiene products because they are not allowed to either. It's weird how they go to commissary. It's a few at a time. They have to stay socially distant. My friend said in Bedford Hills, it's supposed to be 20, 35 things on the commissary list, and they
Wow.
only have 14.
Wow.
So that
Wow.
means they're not getting, if you don't get a package, you're not getting any food.
Wow.
Or your hygiene products, etc. A lot of people that's incarcerated depend on those things, and
Mhm.
these materials are not being provided for them as a woman. And we go through body changes, and the services are not being provided for them. So what I want to put out is that as advocates, we have to pay attention not only to the men, but the women are often neglected. Just like how on the men visiting floor is always crowded, on the women visiting floor is not. If it's not her mother, her child, or her sister, or a family member, then that's coming to see them. We don't have a lot of visits like from a male counterpart, etc.
So we're going to go
So
into
that poses a problem.
solutions. So we're going to go into solutions in a minute, but I want to kick it over to Amy. So Amy, you're hearing Equasia talk about, how the women that she's engaging in work with are being locked down, how they're, prevented access to prevented access to things on commissary and visits and phone, and she's speaking specific, and Equasia speaking specifically in New York, but like, as a person who, leads a lot of work on solitary. Like, what are you seeing like around the country? Is this reflective of other states around the country? Like, how is corrections responding?
Yeah, unfortunately, it is. I mean, I know Naquasia speaking to the New York experience, but it sounds so much like what we're seeing all around the country, and that's true for a number of reasons. Partially it's true because prisons and jails function very similarly across the country, and they tend to be extremely overcrowded. They tend to not be very clean. And they tend to operate in secrecy and without public accountability, in addition to having very poor medical care in the best of times. And right now we're actually experiencing the worst of times, especially in the context of prisons and jails and correctional institutions, immigration detention. It's the same thing. We've got these congregate living spaces that are overcrowded. They tend to house lots of very vulnerable people, as Naquasia pointed out. Folks in prisons and jails often have lots of chronic diseases like asthma, like diabetes. And we know from the CDC that those folks are even more vulnerable to having very serious case of COVID-19. And on top of all that, you've got a lockdown population that can't socially distance. So, I mean, we're all probably talking to folks from our house, which Dr. Fauci has said that's the safest place you can be. Stay in your house, stay in your house. If you are in prison or jail, your house is one of the most dangerous places you could possibly be because you can't properly socially distance. You're around other folks who probably don't have access to could do to protect yourself you can't do in a prison or jail, and no matter how hard you try. And unfortunately, the institutions, either they're not trying or they just don't know what to do. And with their population, there's not much they can do. So it's pretty toxic everywhere. And the reaction on the part of many correctional officials and officers is lock everything down. And we know that quarantining and social distancing is necessary, but solitary confinement is not quarantine. It is punishment. Because we also know that solitary confinement, that extreme socialization that is routinely practiced across this country as punishment in the United States, is what's being used as treatment in corrections institutions. There's no reason for that. I mean, we've talked to public health officials about this problem because we saw it coming, because solitary confinement is that be-all, end-all management technique that is used in corrections in this country. And we thought, oh my gosh, this is exactly what they're going to do. And they're going to hurt people, because we know putting people in solitary confinement actually hurts them. It hurts you mentally, it hurts you physically. And it's pretty much the last thing you need when you're trying to fight a pandemic. But that extreme reaction without thought and without humanity is what we're seeing, instead of thoughtful approaches to dealing with what is no doubt an absolute crisis in these institutions. There are not easy solutions, but there are better solutions than what we're doing right now.
That's an important thing you brought up. So I want to ask you something like related to the question around Ramadan. As a lawyer, you're aware of like constitutional rights and stuff like that. And just thinking about, can you give us a little bit? I see there's a question in the comments about Ramadan, and we're going to actually flesh it out a little bit more during the Q&A part in 10 more minutes. But if you can flesh out a little bit, like, what are, by law, when it comes to being able to express and practice, religion in prison and behind these prison walls, like legally, what's supposed to be allowed, and then maybe if you can give us some feedback on what you see, how COVID-19 has put some of those limitations from your point of view.
Right. So, of course, the free exercise of religion survives incarceration. Both under our Second Amendment, but under specific federal laws that have been passed, because, quite frankly, correctional institutions have a track record of not allowing the free exercise of religion. So there are very sound legal protections for people to practice their religion in prison and jail. Of course, you got to enforce it, and people in jail don't have lawyers generally. So oftentimes it's observed in the breach. In a circumstance like a pandemic, where social distancing is one of the key ways to stop the disease from spreading, correctional institutions will get leeway from the courts in a time, place, and manner. Sort of time, place, and manner restriction is a legal way of thinking about it. So if it's brief, and if it's justified by public health, and if there are other alternatives available, for example, I could imagine putting on the closed circuit television in a prison, a prayer service, making some other things available if you can't have groups of 10 or more, etc. So some accommodation is probably possible. My concern would be that long after there's any public health need for restriction, that those restrictions would remain in place. And so we really have to be vigilant about that, because the tendency always is to be given an inch and to take a mile, and to justify what you're doing based on something that sounds like it used to be justified, but it's no longer justified. So I certainly think, like, in the midst of this crisis, yes, social distancing is going to be necessary. It's very hard to do in these prisons and jails. But how extreme is the burden being placed on religious practice, and how long is it going to last? My guess is that there will be attempts in some places to try to use outmoded justifications to not observe religious rights. that should no longer stand.
Yeah, so NERCAT, we recently signed a few sign-on letters, supporting people freely being able to express, their faith traditions, especially during the month of Ramadan, which, from my understanding, folks definitely congregate together, eat together, they wake up before sunrise, things of that nature. I want to ask you both a question before we actually get into solutions. And Amy, you actually made me think about this as far as, like, as advocates, we've made a lot of changes and a lot of headway that brought us up until this moment, right? A lot of states have sacrificed years of advocacy just to get some small incremental changes, and only to see those rollbacks, those changes being rolled back now. I think New York is one of them where, there were significant changes done to bail reform after advocates took years to get there. So there's that conversation about being able to kind of like hold on to the changes we've already made and not giving more. And its usual adversarial relationship with corrections, if you will, needed too, because sometimes we have to tell corrections what to do, and they don't do it, and then we have to sue them and advocate and things, etc. But I wonder though, because of the common concern around COVID-19, like we don't want people who are incarcerated to have it no more than we want people who work there to have it, because to Naquasia's point, the only people really coming in and out of the facility are correction officers. So just kind of like brainstorming, do you see, or do you think that there are ways that COVID-19 has brought up now we're able to kind of work closer with corrections from a point of view that's for the concern of the safety and concern for all of those involved, that maybe, in other words, are there opportunities now to work or engage corrections because of COVID-19 that maybe did not present itself before? I guess that's my question.
Well, for me, I know that the task force that I'm a part of, the COVID-19 task force that I'm a part of, we have reached out to corrections all the way up to Albany, and they're ignoring us. They feel that the correctional officers, that's their first priority, not the people that are held there in bondage. So, to have a healthy conversation, to get a resolution and to come to an agreement is very hard when it's one-sided. When we dealing with a pandemic, it has to be, all parties have to be involved, they have to be engaged, and they have to be open to change. These, and have a different mind frame that, people that are held there, they are human. That's one thing that I think that the correctional system, any correctional institution, is missing. That the humanness of the humans that are being held here, and that we have to also consider them. When people that are held there are not considered, that poses a problem. And that's where the tug, and that's where correctionals translate their power to say, we doing what we want to do. We have to protect our officers. They are our first priority. So that's why, it's always going to be that type of conversation where it's going to be one-sided. And that's why we commonly in New York State thus far, especially with Bedford Hill, the women correctional facilities, we're advocating for men as well. They are neglecting the fact that there are humans being held in these institutions. And that poses the problem of being divided and not coming to a common ground.
Johnny, I think it varies across the country. We've definitely heard from a number of correctional officers, and actually worked with some on litigation in Dallas County, where you've had officers who are also scared. They are very scared. They're not being given information. They're not being given training. They don't know what to do. They know it's serious. We heard from many officers who were like, I want to wear a mask to work, but I'm being told I can't do it because it will scare the detainees. But I think I'm putting everybody at risk, including myself, by not wearing a mask. So I do think that in some jurisdictions there will be ways to work together, because quite frankly, what we know, prisons and jails are terrible places to live, and they're terrible places to work. Those
Yes.
conditions, their working conditions, their living conditions, that dehumanizing system ultimately dehumanizes everybody who's involved. So trying to build bridges where we can, where there is openness. There isn't always, but I think it's worth the effort because ultimately we win when we all work together as human beings. And changing that punishment paradigm in the United States, where we're not dehumanizing one person to justify the system of another. That's ultimately what it's about. And here we have very common ground where oftentimes the administration is treating both the workers and the detainees and folks who are incarcerated a little bit non-humanly, not working in their common interest, not giving them information, treating them both with fundamental disrespect. So where we can, we should build bridges because it involves all of us.
Yeah. And that brings me right into talking about some policy changes. And you talk about what does winning look like? If, from the point of view of solutions, what are some of the policy changes that you're already advocating, and then policy changes that you hope to see? The president talked about how, and this is actually something we don't think about until in the moment, how in prison you're not allowed to cover your face because of security reasons. You can't cover the lower half of your face. So people that live for correctional officers be able to identify you, should something happen or whatever have you. But that same policy, right, is that now also preventing many jurisdictions from even giving out masks to those, who need it most, and keeping donations, things like that. So I know Nick has a number of policy recommendations, but I'm curious about, what are the advocacy points that you're already working on, and then what do you hope to see happen? Like, how do we get to the finish line and past this quarantine, and help protect those inside?
Well, definitely at the ACLU, we've gone about it two ways. The first strategy is to
You're freezing up a little bit, Amy, I think.
the virus. That's a hard argument to make in some jurisdictions, but we've nevertheless are making it everywhere we can, especially in the context of jails where, and you've seen actually governors and local counties, sheriffs working together to decarcerate, like in New Jersey, to get the populations as low as they can, because they know partially the only way you win is by having fewer people. So decarceration is really important, and we've seen that around the country, especially in the context of jails where we're seeing not enough reduction, but in some places 20, 30, 40% fewer people. So fewer people coming in, very important, and more people just being pushed out who really, quite frankly, don't need to be there in the first place. Wow. So that's going to be a lesson to learn after this is all over. Like, why did we ever hold that many people in jail pre-trial anyway? In addition to, can we look at people who are going out in 6 to 12 months or 2 years? Is there any difference between letting them go home now and letting them go home in a year? No, there's not. They really shouldn't be in there. Get them out. For the people who will remain, though, we have to be concerned that they follow the CDC guidelines plus, because we know that jails and prisons are virus vectors. They serve to spread the disease like no other. They're very equivalent to cruise ships in that way. And so you really have to very strictly implement social distancing, cleaning policies, not once a day, not twice a day, but constant cleaning of appropriate cleaning measures. You have to provide those masks. You have to provide hand sanitizer, and you have to provide treatment and adequate quarantining. And this is very hard because it's 14 days. So how many, you've got all these different people who are on different dates of 14 days. How do you manage that? So what we really need to see, and we're pushing, is the corrections folks can't do this by themselves, and the medical folks generally don't have control over corrections operations, but they have to work together in order to solve this problem. There is no question that needs to happen. And, to date, the courts have done some stuff, not enough, and some institutions have done some stuff, not enough. I think, unfortunately, there's no question that people have died preventable deaths in prisons and jails all over this country already. And I fear that more will follow, especially if we continue business as usual.
Wow. Thanks, Amy. Naquasia, anything back?
Well, what I wanted to say is, and also there's a sister that's in solitary confinement as we speak with COVID-19.
Wow.
She's not getting the proper medical treatment. We all know that, especially if you did time in solitary confinement. So, what's the next step? What is the solution to helping these women remain healthy? How do they remain protected, especially if you live in a dorm? Anyone that's have ever been incarcerated know when you're in the dorm, you have a bunkie on the top bunk and the bottom bunk, and you have neighbors on the side of you, on the left of you, and on the right of you, and in the front of you. So how are you supposed to be protected against a virus that can live within your body for 14 days? Or you might not even have any symptoms, but you are a carrier, according
Mm.
to the CDC. So what do you do? How do you protect these women? And a dorm holds anywhere, but it holds 80 women.
Wow.
Yeah.
So it's a big spread. Like, I'll be honest, nothing but dorms. They hold 90 to 100 women. So imagine the multitude of how many women are being infected with this virus and not getting the proper. For one, in New York State, they're not even testing people properly and at a rapid rate,
Mm-hmm.
right? So I know, and I asked the sisters that I left behind, like, are y'all being tested? And they was like, no, you're only being tested if you have the symptoms.
Yeah. And you know the
So, and
fear with that? I'll just
yes,
cut in real quick. You know that when because corrections has responded largely punitively, locking folks down, minimizing interactions with the outside world, whether in-person visits, small phone calls. Some systems have like short Zoom calls, which takes like weeks to set up. There's a real concern and fear that, because corrections has responded punitively, that people who are incarcerated would not report their symptoms for fear of being placed in isolation or, all of the things that we've described. So like Niqueza, you talk so how do we alleviate that fear for people that are incarcerated, for them to feel comfortable to say, hey, I'm experiencing symptoms of COVID-19, but also not feel like they're going to be placed in solitary as a result of it.
it's really nothing to get around that, because immediately when they report that they have the symptoms, they automatically quarantine, and the unit is automatically quarantined as well and locked down. They're already locked down, even if there's not any cases on that particular unit. So either way, you're gonna get locked down. You're gonna get quarantined. The person that's saying that they're infected, they're going to go to the RMU, get tested, and go upstairs until they get their results to the infirmary. So it's really a no-win situation, and it's scary. I'm coming to you as a human being, telling you that I'm infected with a virus, or I'm sick and I don't feel well, I'm weak, and I'm automatically being punished. I'm not being taken care of as a human being. That poses a problem. And how can we collectively come up with a solution to not to isolate this woman just because she has the symptoms, or having a fear to go to the correctional officer and letting him know that I don't feel well, him not having a fear. He's human as well.
Yeah.
Where's the common ground? There's none.
That's real, because it brings us, to like the NERCAT recommendations. And one of the things that we're strongly recommending is for correctional officials to not use isolation as a containment strategy. So in other words, like, hey, like, yes, you should totally be fighting this virus, but don't fight it by putting more people in solitary, etc. Before COVID-19, we roughly had about 80,000 people across the country who were in these lockdown solitary-like conditions. And literally, like, what feels to be like almost overnight, at least according to the Marshall Project, there's over 300,000 people that are, in similar, conditions that are like literally locked down. And Amy, I know you mentioned 14 days, and that was the intention of corrections. And one of the things I want to add to that is that many of these systems were either already locked down, or sometimes lockdowns already happen as a default response to almost any type of security issue inside of the prison. And these lockdowns look different in different facilities. So we want to emphasize that corrections doesn't use a solitary or separation or solitary as a containment strategy. We've also been emphasizing what's already been echoed here, really to decarcerate as many people as possible. The moment has really showed us that that we don't actually need to have as many people as we do have who are incarcerated, and that people who we think are dangerous are actually not, and are free to go. We're also asking for, of course, for governors, to issue executive orders, but also, to facilitate the immediate of providing a test for everyone who works and lives inside of a correctional facility. Specifically to address your point in the equation, how folks are not being tested, there's no telling who has what, so on and so forth. And then the last thing that we're really trying to push is to ensure that every facility has access to hygiene products and protective masks, or makes the policy changes in order to make this happen.
Right.
And
Well, I
all
know.
in the
No, I wanted to say I know that Cuomo, the New
Mhm.
York State governor, he feels that the correctional facilities is at the bottom of his priorities. They're not at the top. He feels that the people that is in New York City, that's his priority. He's overlooking any correctional facilities. He's really like doing a pushback on the institutions.
Before we open up for the questions, one thing that I'll mention that wasn't necessarily we really didn't tap on, is that what we're also seeing in a number of different states actually, is that corrections has responded by increasing the use of forced labor. And what that means is that in prison, or people who are incarcerated really don't have access to I forget, hand sanitizer, because
Right.
it's so loaded with alcohol, and alcohol is contraband. So for the folks on this stream should understand that part of the difficulty in actually getting these hygiene products, necessary hygiene products, specifically hand sanitizer, to the hands of people that need it most, is because the policy actually prevented to do so. Yet, to the point that's already been echoed about the dehumanization of people who are incarcerated, is that on one side, folks are not valued enough to be able to value, during a pandemic, to not be exposed to it, but at the same time are charged with the responsibility of protecting society, by using forced labor, right? Like here it is, California, Oklahoma, Vermont, Illinois, Texas, Michigan, even my hometown of New York, have all increased. They've even created production of all of these products that these folks that themselves do not have access to. Um, so I'm going to stop right there. We're a quarter of the way through, actually 2/3 of the way through. And I see a question in the comments. And the question says, what does Ramadan look like in prison? Are Muslim prisoners grouped together since they are waking up to eat before sunrise? And are they given extra time to rest, or still expected to work as normal? And I'll take that. I'll send that over to you, an equation, since you have that direct experience with Ramadan inside, and so on and so forth. And now, um, uh,
Well,
hmm?
is it specifically during this time or just Ramadan overall? In prison without a pandemic.
Yeah, I think too. I think you can talk briefly about like Ramadan in general. What does that look like in an incarceration setting, and then
Okay.
how this layer of COVID-19 though now has changed that to some effect. And of course, Amy, jump in. However you feel free.
Well, in Beverly Hills Correctional Facility is a max facility for
Mhm.
women, so we're not allowed to like congregate in the morning um to make prayer together, but we can do it in ourselves or in our cubicles individually. We do break our fast together. We read the juice together. We are all congregated in the mosque at 6 o'clock during the movement line, before the movement line, so we can have extra time to get to our destination. And it's as program as usual. You go to program, you go to the mosque after, and you participate. You go get your meal. We eat together, and it's hard. Especially if you have an officer that's in the lobby that's want to disturb the peace of the mosque. I was the emira during my incarceration. The emira is the leader of the mosque, so it has been plenty of times I had to um, put the correctional officer in his place about us observing our religious exercising our religious rights. And I had to let him know, like, I know my rights, and they may not know their rights, but I'm their representative. And from that point on, like me and a correctional officer or any correctional officer that had the mosque or the chapel area did not disturb
Mhm.
our peace. No
Mhm.
matter how you may view a Muslim, because there's a lot of Islamic phobia in prison, especially coming from the correction officers,
Mhm.
saying, that we're fake Muslims. Y'all were, even 2015, they were still saying that, we were, um, that the twin towers, that the unfortunate tragedy, that we were at fault. What type of
Yeah.
religion, it's a lot of what type of religion is that, etc. And as a woman, we are the first educators, so I had to educate and enlighten a lot of correctional officers, and as
Mhm.
well as sergeants, and
Mhm.
which I don't have a mind doing. Ignorance is not always bliss. And when you don't know, you tend to impose your opinion on the next person
Mhm.
or a next group.
Mhm.
But Ramadan currently is still being observed in prison during this pandemic, but it's not like it was. We are not they're not allowed to congregate in the mosque. They have to do everything in their cell or in their cubicle.
Wow.
Mhm.
Yeah. And you have anything to add to that? You good?
Yeah.
That sounds about right to me. Yeah.
Yeah.
Mhm.
Do we have any other questions that people want to drop in the comments? Please feel free to drop any questions, about COVID-19 and how it's impacting people inside who are currently incarcerated. Any questions around current efforts to protect, our loved ones inside. I see folks literally coming in from all as far as Iraq. Blessings to you. You know, here's another thing that really there is no justice inside of prison. You're right. It's sort of like an oxymoron, if you will. I'll say that right now is a critical moment where people of faith are really called on to hold our legislators morally accountable to the values that they say that they stand for. Many times we have lawmakers who gave us promises and who say that they are, that they reflect our values and our wants. And I like to urge folks to really take really strong inventory and awareness of the decisions that are made, not only already made in the last 2-3 months, but also made over from now over the next 6 months, and hold folks accountable at the ballot, hold folks accountable, moving forward. Because in times of crisis, lawmakers have to have the ability, even critically, to protect folks who are the most vulnerable. And people who are incarcerated are literally just sitting there waiting to die. On my Facebook page very recently, I posted a video about a young man in Ohio who is currently incarcerated, and he is triple bunked. He is locked in a cell with two other people who are also exhibiting COVID-19 symptoms. One person already has it. This young man has 1 year left to his sentence. And he made the video knowing that he's going to get in trouble, right? Because he had a smuggled cell phone, but also out of fear that his family would not ever see him again because of social distances, because of the policies in prison do not allow us to engage and interact with our family members. And it really hit home for me because the desperation, that I once experienced and saw, during 9/11, like you mentioned. I saw it again during Hurricane Katrina, like really, really awful during Hurricane Katrina. And now we see a lot of it now, you know. So really emphasizing the whole folks really accountable during this moment. I see a question came in. Are volunteer chaplains being allowed inside prisons during COVID-19? Anyone
No.
can take that.
No, the chaplains, you have to be, you is no volunteer. You have to be a part of the correctional, like you have to be a chaplain at that particular institution. There's no volunteer anything as of right now. Is That's put on hold as well. So
Nice.
a lot of programs that's ran by volunteers is not going on because of the pandemic.
Amy, are you seeing that also across the
Yeah,
country?
that's very true across the country. And, many prison systems, yes, they do have staff who are chaplains,
Mhm.
but the vast majority of programming, religious or otherwise, is volunteer.
Mhm.
And I'm actually not aware of any systems that have not stopped volunteer programs. And partially you can understand, like, they don't want people coming in and out of the facility because people from the outside are the ones who are going to affect the inside. But at the same time, no other accommodations have been made to continue programming, to do something. So you have people who are warehoused, locked down, doing nothing and having no outside contact, which is very problematic. Because of course, when we think of these institutions, part of the reason we worry about them so much is that they're so close to public purview. And that's why so many awful things happen, because the public can't walk in. I mean, I need a court order to get inside a prison. That's a lot, and very few people can do that. So it's so important. And I think as part of the public, what you can do is just push your state legislatures, push your governor, who is the boss of your state corrections department, to be more open to the public. They should be reporting every single day who's tested, who's positive, who's negative, who's died, who's on a ventilator, who's in the hospital. We need all of that data collected. It should be open, and they should be communicating with the families who are, of course, terrified for their loved ones. And the people inside are terrified, like the example of the young man you talked about, Johnny. Terrified that his family's not going to know what happened to him, and he'll never talk to them again. This is the time to make more communication possible. And as we've all experienced, that is actually, I mean, we're all sitting in our homes. More communication is possible. It's not one-on-one, but making more Zoom available, making more telephone calls available, making it all free. Because when people don't have information, they get even more scared. And then rumor starts and they don't have good information. So I wish that corrections would not do what it usually does, which is reflexively hiding and closing down, but rather open up. They are going to be better off. We're all going to be better off if the public knows what's happening inside these prisons and jails and has a vested interest in having a good outcome. Because for too long, people have been able to look away and let us build these prisons and jails and warehouse people and dehumanize them for decades for no good reason. So now is the crisis is an opportunity. We can start doing things differently, and we absolutely should if we want to remain a country that respects human rights. Because right now we're not doing that so well.
That's real. And you have something you want to add, Niquasia? Sorry.
No, I say no, we're not. To piggyback off of what she said, Andy said, like, it's a lot of fear, and we have to hold our officials accountable. Just like I said, Governor Cuomo, we're, people that are institutionalized, are in institutions, are not on his priority list. Just like a lot of women, it's a couple of sisters that have compromised systems that they have to go to an outside hospital where they're not allowed to go to outside hospitals because they're not taking them. So they have to stay because the facility is not equipped to handle whatever chronic diseases that they have. So they're suffering. Like, even if you don't have it, like, I can't even get the proper medical treatment that I need in order to survive. So it's just like, it's like a hamster on a wheel. Like, it's just keep going, and it's a never ending story. I think that as advocates, we have to, we are doing the work, and we are advocating for the people that we left behind, internationally, nationally, in our state. And I think that's important for us to keep keep advocating. And when elections come, we need to bring up these concerns. How they handled when people people that are incarcerated, how they handled the situation, how they handled the situation overall. Like, for New York to have the highest rate of COVID-19, why are we not having a whole lot more testing? Only 30,000 people were just tested just yesterday. I mean, but this has been done during the course of it, since we were declared a pandemic. That's a problem, nationally and internationally. So, I think that we all have to pay attention to these things. And when elections come, we need to bring up these concerns, because they said that this is not the first. This is only the first wave. It's going to happen again. So what's going to happen?
And we don't want to set a new normal. So we're coming up on 5 minutes left, and really quickly, if you can spend less than a minute, right? Like, because this is very grim, right? If I'm sitting at home, I'm like, oh wow, like this problem is so huge. Like, what is little old me? Like, where do I find hope? So, if you can spend, 30 seconds or so, like, where where can people find hope, or where do you find hope in the midst of all of this atrocity? Like, if what do you feel good about or optimistic about? Before before I pass it back off.
Well, I feel very optimistic about. I pray. That centers me. That keeps me focused. It keeps me aware because God, for me, is the only one who can change any of these conditions. And to keep always advocating, and I mentor young girls that are at risk, and I also keep them hopeful because they don't have any hope. These girls are supposed to be graduating, and they're not. And it's a problem, So I keep them very optimistic. I'll um, tell them to always see the glass as full, half full, not half empty. To give them hope, to give them encouragement, to empower. I empower the ones that I left behind. I empower them sisters to keep, stay as safe as possible.
Mhm.
Try social distancing and to do all these practices.
Nice. Thank you, Naquisha. Amy?
Yeah, I mean, I'm frankly, I'm hopeful for even discussions like this that wouldn't have happened 2 months ago. It's really, this is a crisis and it's a tragedy, but it's also an opportunity to learn from our mistakes and do better. And the fact that we're having these conversations, this is one of those conversations, but they are happening around the country. And people are talking about what's happening in prison and jail more than they previously did. I've been working at this for 20 years. That's an important opportunity. So to change the way we do business, I think too many people get locked into the idea like, oh, well, this is the way it is. This is the way it's always been. That's actually not true historically. It's the way it's been for some years, but in the scope of time, actually not. I mean, if we were having this conversation in the 70s, it would have been a very, very, very different America we were talking to, and not an incarcerated America. And we can go back to that. We can change. We don't have to do things business as usual, and we can take this opportunity. Unfortunately, some people are losing and have lost their lives, but those lives should not have been lost in vain. We can take that tragedy and turn it into an opportunity to do better for other people. So let's do it.
Nice. Amy Fedek, Naquisha Paula, thank you so much for making time out of your busy schedule. Thank you so much for the work that you're doing. Like I really mean that, not just the webinar, but I really do mean that. And keep on the good fight. I'm going to go ahead and pass it back over to Zane, who just joined us. Thank you so much for creating space for us to have this conversation.
Yeah.
Absolutely. I want to thank, like Johnny said, I want to thank our guests for sharing their experiences. Thank you, Amy and Nakisha, in giving your guys' insights on such an important topic. More importantly, I want to thank Johnny Perez for moderating this webinar and leading our discussion this afternoon. We pray for ease for everyone during this global pandemic, especially those incarcerated. Thank you to our audience for joining, and we hope that you learned a lot. If you are not able to ask questions, please feel free to reach out on our website or send us an email. That way we can pass it off to our amazing guest. Lastly, please donate to our Muslim Prisoner Support Project at the link below at icnacsj.org/donate. Anything helps in this difficult time. Thank you all.
ICNA Council for Social Justice is a social justice human rights organization that strives to systematically facilitate assertive Muslim involvement in the field of human struggle for the rights of the poor and oppressed in the United States. One of our main projects is to support one of the most neglected Muslim communities, our brothers and sisters in the prison system.
Before the program, we didn't have volunteers from the outside that were coming in here, taking their time out of their day to go get us books, to go make sure that we're able to learn properly.
Our Muslim Prisoners Support Project's main objective is to support Muslim inmates in detention and correctional facilities by providing them with prayer services, Islamic education, weekly religious classes, equipment, supplies, and free Eid meals. Additionally, we provide resources for civil rights procedures and actions, mail correspondence, and a full-fledged re-entry program.
It's been really helpful for me being a new Muslim because I'm able to participate in the Friday prayer, and I'm able to get Islamic material.
I'm back connected with my religion.
It's helping me get on a better path of life and finding, my faith.
ICNA CSJ needs your help. Please consider donating today by visiting our website or email us at prisonersupport@icnacsj.org to volunteer. Thank you.